Hi, my name is Samantha Leva, and my proposed research topic seeks to answer the question, does music therapy help students regulate emotions and behaviors? I got the idea for this particular study from one that was conducted by Ulig et al., where they studied the effects of rap and sing music therapy on students in the Netherlands, and they found that the students showed an improvement in regulation abilities. They did, however, suggest that future research be done on a more culturally diverse population that may experience more hardships. Other literature studied groups of at-risk youth who were given the treatment of music therapy and found that they had lower levels of depression and anxiety and better emotion regulation. They also found that the students enjoyed the sessions and they felt confident in their abilities to continue to use their new resources in the future. Hedman and Fraser studied students in an urban neighborhood at risk of developing depression or anxiety and found that after being exposed to music education programs in an after-school setting, the children had lower rates of internalizing symptoms, better resilience, and better social skills. And then Yao and Fochner, they studied how the musical therapy technique of repeating motifs helped students to need less reminders to stay on task, and they were able to get back on track more quickly, so it had an effect on the students' ability to regulate their behaviors better. All of those literature articles help support my hypothesis that music therapy will help students learn to regulate their emotions and behaviors. So the null hypothesis of the proposed study is that music therapy will not have an effect on student emotion and behavior regulation will remain the same. We gathered the participants for this study from a low-income school, and the students themselves are fifth grade students who exhibit signs of emotion or behavior regulation problems. The students will be gathered through cluster sampling, where each cluster that's used is a predetermined class that these students are already in from the school district. The research study is a between groups pre-test, post-test study, and it uses simple random sampling to determine which cluster group receives the treatment of music therapy or the control of just typical teacher interventions. Teachers are asked to fill out a strength and difficulty questionnaire for their students as a pretest, and this is used to assess students' emotional symptoms, behavior problems, attention difficulties, and relational or prosocial problems. Some examples of questions on that include the student often loses temper, they're restless, overactive, cannot stay still for long, or they are considerate of other people's feelings. The students themselves are given a pretest of difficulties in emotion regulation scale, which is a self-report survey where the student answers questions on a 1 to 5 scale about how well they believe they're able to regulate their emotions. And some sample questions on that include, I am clear about my feelings, I pay attention to how I feel, or when I'm upset, I become angry with myself for feeling that way. After the students and the teachers have completed these questionnaires, we start 8 weeks of once a week, 30-minute treatment sessions where the treatment group receives music therapy, specifically the rap and sing music therapy that Ulig et al. Talks about, where these students are taught to vocally express their emotions through singing or rapping, rhythm to help externally express emotion in ways that promote group cooperation, and helping these students create their own rhymes or song lyrics to help express how they're truly feeling. In contrast, the control group has one 30-minute session for 8 weeks, done by the teacher on topics that align with school goals, such as pillars of character, different ways to develop their language skills, and having the kids move around and doing physical activities. After the 8-week treatment period, a researcher who has not been involved up to this point and is completely unaware of which classes received treatment and which classes received control observes a class session for each of those classes. After the observation, the researcher is given the strengths and difficulties questionnaire to fill out for the students in the class, and then the students themselves are asked to fill out the difficulties and emotion regulation scale again. So both of those would be the post-test. After all of the questionnaires have been filled out and collected, the researchers score the questionnaires and run paired groups t-tests to discover if there's a statistically significant difference in scores between music therapy group and the control group. And they can also use a t-test to compare the pre-test and post-test scores specifically for the music therapy group, just to determine exactly how significant of a difference the music therapy made in those kids. So that is my proposed research topic on music therapy and the effect on student emotion and behavior regulations. Thank you.